call-in office today. We have a bunch of questions that have come in today, and we're happy to answer questions. So if you guys want to direct message us right now, we'll answer any questions that you may have. One of the things that people wanted to talk about today was facial rejuvenation. And you know, we like to get that really natural look no matter what we're doing, whether we're doing facelifts, eye lifts, noses, or whatever that is. That natural look is super important to us. So people wanted to hear about eyelid lifts. And what an eyelid lift is for the upper eyelid, we remove the extra skin. I think I have some extra skin. I have extra skin
You're
now.
showing everyone that you need your upper lids done.
I need my upper lids done. So I have that extra skin now, and as we age, not that I'm aging, but I guess I am, but as we age, I am getting that extra skin, as we all are. And by getting the extra skin, what we do is we do an upper eyelid lift. And that is where we make an incision right in the crease, remove the extra skin there, remove a little fat pocket, and it makes you look many, many years younger.
A lot of times we'll combine CO2 laser or fat grafting when doing eyes too, so you can add a little bit of volume to the cheek area, because whenever we look at eyes, the teardrop area, we look at cheeks as well. And the CO2 laser is amazing. So you can do your full face or just under your eyes.
Well, also, we have to talk about the lower eyelids. People forget about this, and a lot of people have extra fat there, so it becomes puffy.
Don't look at me.
They have extra, no, I was just checking to see if you had an extra fat there. Any extra skin there we can remove. So we remove the fat, we'll often CO2 laser it to smooth it down. Sometimes we remove the extra skin by taking the skin out and pulling the eyelid up. But again, natural is really, really important to us. Balancing this with the CO2 laser often helps really rejuvenate the lower eyelid nicely. And people ask about those crow's feet that a lot of us get. And crow's feet only go away with Botox. It doesn't go away with doing surgery.
Yeah, but the laser helps with that crepiness under here. So you can't really put too much Botox
I think you need to talk louder.
Oh, can you hear me? Oh. CO2 laser is great for the crepiness under here. The Botox is great for the crow's feet, as you said.
Right. That's good. That makes no sense. But yes, Botox here, CO2 laser,
Yes,
CO2
sense.
laser and Botox combination works great.
Do people combine eyelid lifts with brow lifts?
All the time. So that's a great question. We combine brow lifts and eyelid lifts and brow lifts and face lifts all the time. And when we do a brow lift, we make an incision.
The yawns are coming.
The yawns are coming. One of my patients said,
only when you go live.
Yes, one of my patients said, I watch your lives all the time and you're always falling asleep. I don't know why. But anyway, when we do a brow lift, we make an incision up, usually up in the hairline, and that helps to pull up the eyebrow area. That's different than doing an eyelid lift. So there's the eyelid and then the brow lift, and they're kind of separate sort of entities. And let's talk a little bit, Sarah, about facelifts, because we do a ton of facelifts here, and I'm all about looking really natural. We do them here every day, super common procedure, and often we'll combine faces with eyes.
A lot of times patients will do a facelift, again, with eyes, fat grafting, laser. There's a lot of things that you can combine when doing the facelift. You're getting ready to yawn again.
I just did. You missed it.
But there are different types of facelifts, so you don't just need a full facelift every time. Some patients will come in and they'll get a mini facelift where it just targets a little bit of the jowl, a little bit of the neck. There's something called the micro mini facelift that you created where it's just a small incision in the crease of the ear and sometimes under here, and that just pulls a little bit of the jowl. You're out of work for a weekend, basically. That's it. And you can combine that with fat grafting, with Sculptra, with injectables, with laser. So you can do a lot of facial rejuvenation without getting a full facelift. If you have that extra skin and you need the facelift, then there's really no getting around it. But again, a lot of different procedures that you can combine to give you that overall natural result.
I think combination of the right procedures is super important. We also do a lot of corrective work here at Greenberg Cosmetic Surgery. So we correct a lot of facelifts that are done by usually less experienced sort of people. And we can usually fix sort of things. Wait, I have something for you here, Sarah. We need to get,
wow.
here, you gotta get the, there you go. It matches your outfit. Get the Greenberg
I'll
hat
wear it.
going. Yeah,
Okay.
you gotta wear that. So yeah, combining different procedures.
Why won't you wear it?
Yeah, I don't
Yeah,
wanna
come
mess
here.
my hair.
Come here, Dr. Greenberg.
No, Sarah looks better and she's wearing all black, so that's
All
perfect.
right.
All right, guys, any questions you have, just direct message us. We're happy to answer it. Let's talk a little bit, Sarah, about what timing for doing bodies, like doing a.
I can't wear this anymore.
No, yeah, it looks good. It looks good. Timing for doing breasts, timing for
Uh-huh.
doing tummy tucks, liposuction, male chest reduction. It's in the winter now,
Mhm.
so and people want to get their body ready for spring, for summer. Just took time.
So a lot of patients, I mean, even if you have vacations, patients are coming in now to get ready for their winter, spring vacations. If you want to be done and ready for summer, come end of winter, spring. So it all depends on what your timing is, and we can figure out the timeline for you. So you come in, you explain what's bothering you. We can figure out what procedures work best, and then figure out the timeline too. So if you want to target different areas, mommy makeover. You can do your breasts, you can do your belly, you can do liposuction, you can do vaginal rejuvenation at the same time.
Let's talk about
That's
that.
the modern mommy makeover.
Yeah, because Sarah heads up the vaginal rejuvenation and labiaplasty center here at Greenberg Cosmetic Surgery, and she does tons of these. It's her favorite thing in the world to
Yeah.
spend her time with your vagina, I guess. But Sarah, talk a little bit about your love for vaginas.
Sure.
Sure.
A passion of mine. But in all honesty, it's a great laser. It's a great procedure. We do a ton of it. We have the newest vaginal rejuvenation laser. It's called Morpheus Empower. So it has 3 different handpieces on it, and it targets every issue that you could possibly have. So dryness, laxity, urinary incontinence, urge incontinence where you feel like you can't hold your pee and you're running to the bathroom. Dryness, it's great for menopausal women or perimenopausal women that are starting to get those changes and have issues. Painful intercourse. You can target any issue. It takes 30 minutes to do. You go home the same day, completely painless. We can do it while you're asleep in the OR at the same time. And then it's 3 sessions. So great treatment, highly recommend. A lot of women will combine it with their tummy tucks and with their breasts.
Yeah, simple to do at the time of a tummy tuck, and again, none of this stuff hurts. And labiaplasty is the other thing that we do often at the time of a tummy tuck. What's a labiaplasty?
So that's the surgical aspect that targets the outside. So the labia are lips. They can be different colors, different shapes, depending on, women's anatomy, childbirth. As you age, they can get thin and get a little bit longer also. But we can remove that extra skin on the outside, tuck everything in, so it can help with exercise and intercourse and all those things people get with irritation and the skin rubbing. So again, quick procedure, 30 minutes, minimal downtime.
Simple stuff. Any questions for us, Steph?
No, but I have a question.
Okay.
Sarah, your skin looks very glowy on camera.
thank
Can you
you.
talk about your skincare routine?
So this is a good time for lasers and for hydrofacials, also skincare every day, using the right skincare, sunscreen, Dr. Greenberg skincare, his scrub I use every week, but Retin-A, all that stuff, the right face wash. If you guys are unsure of what to do for your skin, come in. We can do a full skin consult just for your skin and figure out what creams and what topicals work best.
And
It's overwhelming for people.
Yeah.
They don't know what to use. So.
And we do a Visia skincare analysis so we can show you what's really under your skin that we're not actually seeing. So it's actually pretty good. So another question that has come in is the difference between a breast augmentation and a breast lift. So a breast augmentation is just simply putting an implant in place. A breast lift is lifting up the breast. So that's removing the extra skin and boosting the breast tissue back up where it's supposed to be. So that's the difference between a breast augmentation and a breast lift. And often they're done at the same time. So that's kind of a simple thing that we do here in the office. Most of the procedures we do, about 99%, are done in our office ambulatory centers, and patients go home the same day. And if you want to come down and see us, go to greenbergcosmeticsurgery.com or call 516-364-4200. You'll get hooked up with one of our offices, whatever's closest for you, whether it be Manhattan, Westchester, which is our newest offer, Woodbury on Long Island, Smithtown, Long Island. the Hamptons on Long Island or Florida, whatever you want to do. And we'll see you soon. Stay tuned. This is Dr. Stephen Greenberg.